Now, my dear friends, we'll be discussing the differences between the pediatric and the adult larynx. So, pediatric versus adult. Now, if you see the points carefully, first of all, we'll be discussing about the position. In a pediatric larynx, it is situated high above. So, it is situated high at the level of C2 to C3 vertebrae, whereas in adult, it is situated low from C3 to C6 vertebrae. Now the narrowest part, this is again a very important question. They ask you in the exam, what is the narrowest part of the larynx, be it pediatric or be it adult. In pediatric, the narrowest part is the subglottis. Okay beta, remember subglottis is the narrowest part in the pediatric age group, whereas in adult, it is the glottic. Now coming to the epiglottis. The epiglottis in a case of infant or a pediatric age group is omega shaped. So it is this shape, that is omega shaped, whereas in adult it is leaf shaped. So it is leaf shaped in adult. The thyroid cartilage is basically not angulated in case of pediatric. So it is basically flat, whereas in adult it is angulated. So this angulated, the angle is around 90 degree in males. So it is in 90 degree in males and around 120 degree in females. Whereas if you come to the shaped neck, now the shape is, it is inverted cone. It is inverted cone or funnel shaped in pediatric, whereas in adult it is cylindrical. Now coming to the nature of cartilages, the cartilages are basically soft and compressible. They are soft and compressible in case of pediatric, whereas as they are ossified in adults, so they are hard and they are not compressible. So they are more prone on getting the fracture because of any trauma. Now if you see the submucosal loose connective tissue, the submucosal loose connective tissue is abundant in pediatric and it is scanty in adult. So if it is abundant in pediatric, mean any laryngeal infection, it can become emergency. So any infection, laryngeal infection, pediatric laryngeal infection, it can become emergency because of the swelling of the submucosal loose connective tissue. Because of the swelling of the epithelium, the airway may get compromised. So it is a emergency. Any infection of the submucosa loose connective tissue is an emergency. So just to revise the position of the pediatric larynx, it is situated high in case of pediatric, whereas in adult it is low. The narrowest part, again, it is the subglottic in kids, whereas in adult it is the glottic. The epiglottic is omega shaped in pediatric, whereas it is leaf shaped in adult. The thyroid cartilage, the Adam's apple, if you see, so it is flat, it is not angulated in case of pediatric. So it is flat in pediatric, whereas it is angulated in adult. So angle can be 90 degree in males or it can be 120 degree in females. The shape of the larynx, the shape of the larynx is like an inverted funnel. This is inverted cone or a funnel shape. So it is like that in case of pediatric, whereas it is cylindrical in case of adults. So cartilage in case of pediatric, it is soft and compressible, whereas they are hard. So if they are hard because they are ossified. The laryngeal cartilages of pediatric age groups, they are soft, they are not ossified. So if any blunt trauma happens to them, so there are less chances that they may get fractured. So adult cartilages, they are more prone of getting fractured. And last, the submucosal loose connective tissue is abundant in case of kids. Therefore, any laryngeal infection can be an emergency, whereas they are scanty in case of adults. So it is not an emergency. cut. Now coming to stridor. Okay, beta, what is stridor? The stridor means narrowing of the airway. So the noise which is produced because of the narrowing of the airway is the stridor, and this stridor is basically of three types. Write down, beta. It is basically of three types. It can be inspiratory stridor. Inspiratory stridor, when the stridor occur, there are two phases of respiration, that is inspiration and expiration. So a stridor which is occurring in inspiration is known as the inspiratory stridor. So inspiratory stridor is seen in the level of obstruction will be it will be in the pharynx, or it will be in the supraglottic area. So inspiratory stridor occur in pharynx or supraglottic area, whereas the expiratory stridor, it occurs in the when there is obstruction in the thoracic trachea, or the secondary bronchi. And there is one more type of stridor, that is known as the biphasic stridor. That is, the stridor occur both in inspiration as well as in expiration, and it occurs when the obstruction is at the level of, it can be either glottis, subglottis, or the primary bronchi, or the cervical trachea. So just to revise, stridor is a noise which is produced because of the obstruction at the level of the airway, and there is basically the narrowing of the airway, and there are various types of stridor which are being explained depending upon the level of obstruction. If the level of obstruction is at the pharynx and the supraglottic area, it causes the inspiratory stridor, whereas if the stridor is occurring during the expiration phase, it can happen when there is obstruction of the thoracic trachea or the secondary bronchi. And biphasic stridor is the stridor which is happening both in inspiration and expiration, and it occurs when there is any obstruction at the level of glottis, subglottic, primary bronchi, or the cervical trachea. So from secondary bronchi onwards, if anything is occurring, it can to till the bronchioles, it is because of the there is the lower respiratory tract. It is a lower respiratory tract sound, and it can be a rub, it can be a wheeze. So basically you have to remember stridor, and these are the types of stridor which are very important from the exam point of view. Cut. एक बार देखना इसमें वो आ रहा है.